Hello guys, welcome back to Simplified by Jinal Shah. Today we are going to do a remedy called Revolvia serpentina. Very commonly known remedy. ज़्यादातर लोगों ने इसको हाइपरटेंशन के लिए सुना होगा और काफ़ी लोगों ने इनडिस्क्रिमिनेटली प्रिस्क्राइब भी किया होगा और कोई पेशेंट्स तो खुद से ही ले लेते हैं रेवॉल्फिया। दैट इज़ वाई इट इज़ इम्पॉर्टेंट कि हम ये रेमेडी क्या है, उसके इंडिकेशंस क्या है वो समझें और फिर उसको डिस्क्रिमिनेटली प्रिस्क्राइब करें, राइट? So, since I've already mentioned that it's a remedy for hypertension and the family is Apocynaceae. Apocynaceae में से हमने एक ऑलरेडी ड्रग किया हुआ है एपोसाइनम, which was one of the first drugs I posted. You could check that video out. Now, starting with Revolvia, let me first tell you, because it is hypertension remedy, there are some symptoms of hypertension which will be clearly seen. Okay, the most common symptom जो hypertension में लोगों को आता है वो है headache. तो हम लोग यहाँ पे ड्रॉ करेंगे. Now, हेडेक का भी कैरेक्टरिस्टिक है कि हेडेक इज़ लाइक अ बैंड. जो टेंशन हेडेक होता है वो टाइप का हेडेक है. सो दिस यू कुड कंसिडर कि बिगिनिंग ऑफ द हाइपरटेंशन एपिसोड में होता है जब न्यूली डायग्नोस हो रहा है. तो वन ऑफ द फर्स्ट सिम्टम इज़ हेडेक. नाउ हाउ इज़ द हेडेक? हेडेक इज़ लाइक अ बैंड, एज इफ द फोरहेड वॉज कवर्ड विथ अ बैंड. और यहाँ पे अच्छी चीज़ यानी द पर्सन फील्स बेटर विथ ओपन एयर एंड कोल्ड एप्लीकेशन. ठंडा कुछ लगाया तो उससे अच्छा लगेगा. Second, which is very initial state symptom of hypertension or in general of any headaches, is the eye pain. Eye pain का भी reason यही है कि because there is too much pressure, there is eye pain. Now the characteristic of eye pain is that the pain is, I will write here second as eye, the pain is more on motion. यानी टू और फ्रो यहाँ वहाँ देखने से पेन ज़्यादा होगा. सो द पर्सन वुड आइडियली वॉन्ट टू नॉट हैव एनी आई मोशंस फॉर हिज ओन कम्फर्ट. Now to give another brief about hypertension is that it is a psychotic disease. यहाँ पे काफ़ी टाइम लोगों को पता ही नहीं होता है उनको hypertension है और अचानक से एक हाथ चेकअप पे डिटेक्ट होता है. बट दीज पीपल कॉमन सिम्टम्स जो उनको दूसरा है वो हम माइंड सिम्टम्स में बोल सकते हैं, which is anxiety, restlessness and nervousness. यूजुअली ऐसा देखा गया है कि post an aggressive episode या post a lot of stress, the person is diagnosed with hypertension. It may not necessarily be the cause of it, because it's a psychotic illnesses जहाँ पे जल्दी diagnose नहीं होता. There are very few symptoms unless you actually measure your blood pressure. So these are your mind symptoms: anxiety, restlessness and nervousness. Since we are at mind, I would like to talk about dreams, which is more of a homeopathic concept. यहाँ पे the person has dreams of body parts where either they are dismantled, यानी there is some deformity, जैसे jaw broken. This is the most peculiar symptom of the drug. उसको dreams आता है कि उसका jaw broken है. Okay, now still moving ahead with some common symptoms, which might not necessarily be very common, but you can relate it pathophysiologically, is there is flushing of face. Right here for face flushing. Pathophysiologically, because there is increased blood pressure, there is increased pumping of blood in this area, there is face flushing. Now face flushing is worse 6 to 8 p.m. Most common. Now why this is a characteristic symptom? Because flushing of face usually happens in bright sunlight when it is too hot outside, but 6 to 8 p.m. is a reasonably cold environment. ये टाइम पे अगर फेस फ्लशिंग हो रहा है then revolvia is indicated. Along with that, there is one more symptom which is similar, is that on skin the person may have red patches, which is again unrelated, but it's a characteristic symptom. Now, if you see so far, these are very initial stage symptoms of hypertension, mainly the headache part and the eye symptom, and the face flushing you could still consider it. अभी हम लोग थोड़ा नॉन पिक्यूलियर हाइपरटेंशन सिम्टम्स पे जाएंगे. Then we will go on to full blown hypertension symptom. Non peculiar hypertension symptom is related to mouth. There is increased salivation. Now, I cannot relate why hypertension would cause it, but in case if somebody knows about it, please write down in the comment section below. There is increased salivation. Then we move on a bit further down. There is, I'll give this as 5th, 6th as throat pain. Again, I don't know why, but there is throat pain which is burning in nature, and worse, swallowing saliva. Worse, waking up in the morning. So these are your throat symptoms and mouth symptoms which might not be directly related to hypertension. Now, if somebody knows hypertension ka complication, most famous one is related to your heart, right? So यहाँ पे भी हम लोग अभी जब chest symptoms पे जाएंगे, you have to relate that because of hypertension there has been complication in the heart system. Coronary artery illnesses are very common. So abhi let's move on to the chest symptoms. Most common thing which which everybody would understand by the mere fact that I have said chest is that there is going to be breathing difficulty on exertion. Now, why does this happen? Because if this is my blood vessel and there's been constant pressure over here, there's going to be damage over the course of years. हमारे हार्ट के ब्लड वेसल भी डैमेज होंगे इस वजह से, एंड देयर माइट बी ऑल्सो अथेरोस्क्लेरोसिस, which is again a pathophysiology of Revolfia, atherosclerosis. Because of these symptoms, you can have heart complications, one of which is breathing difficulty on exertion. Second हो गया तुम्हारा angina, that is chest pain. Again chest pain on exertion, that is slightest exertion. But the characteristic symptom here is that even on rest the person has chest pain. तो exertion पे भी है, rest पे भी है. Chest pain जो है वो यहाँ पे near the sternum, it's located in the lower sternum part, and it also radiates to the front and to the back. So there is radiation as well. It starts in the lower sternum, radiates to front and the back. Now you understand why I call this also a complication of hypertension, because hypertension is very closely related to your heart symptoms. Correct? So let's just quickly look at the chest symptoms. Breathing difficulty on exertion. Running short distance also causes difficulty. There is angina or chest pain, which is worse at rest, worse in exertion. The pain is more of cramping nature. It's called as cramping pain. It's in the lower sternum. We've covered this part already. And now the pathology behind it could be atherosclerosis or could be because of hypertension. Now this was mainly the hypertension symptom जो भी Revolfia का है, because it is homeopathy there has to be some gastrointestinal symptoms as well. So let me draw a lower abdomen here. Gastrointestinal symptoms में क्या है ना, there is heaviness. I'm drawing some weights here. So you could say there is heaviness and indigestion. Again, both of these is worse 6 to 8 PM. तो ये हमारा एक peculiar time modality हो जाता है. Heaviness, indigestion, distension of abdomen. Distension, worse 6 to 8 PM. Most common stool symptoms. Stool symptoms में क्या है? Stools are alternating. So they are watery and loose and they alternate with normal stools. The abdominal symptoms are worse with coughing. There is a sharp pain on coughing because there is broad distension here. This might not be directly related to hypertension. There could be multiple reasons or pathologies that could cause these gastrointestinal symptoms. Now, another thing for prescribers, that Revolfia serpentina is given in the form of mother tincture along with Crataegus. We have Revolfia and Passiflora, these three given together, but this is not for any patients. You are only supposed to take prescribed medicines for your hypertension. Secondly, when we were talking about anxiety, restlessness and nervousness, this is again worse at night. So the person जो बोलते हैं बेचैनी हो रहा है रात को, which could again be a symptom for hypertension. Few very basic understanding for if there are any patients watching it. If you are diagnosed with hypertension, try to find out the cause. It could be dietary, it could be hereditary, it could be your lifestyle, and please try to modify that first. Do not indiscriminately take Revolfia or any other hypertension medicine for that matter unless a doctor has prescribed it to you, and make sure you buy a BP machine to regularly monitor your blood pressure, because like I said, there are very few symptoms to begin with and you might not even know when you reach the complication part. Alright, to end the video, Crataegus, Revolfia, Passiflora 1:1:1 ratio in the mother tincture form is usually prescribed or is at least mentioned in the books for hypertension. You can check the video of Apocyinum, which is also from the same family. And I hope you guys like this video. I made it pretty easy. You start from top to bottom: mind, head, eyes, face, saliva, throat, chest and abdomen, and you're done with the remedy. Please hit the like button and subscribe to the channel if you haven't already. Thank you.